Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. My dear friends, this video is related with the human physiology, and we would like to check the cranial nerves which is arising or which are arising from the brain. So this particular video is explaining how to perform the clinical examination of cranial nerves, especially first cranial nerve, that is olfactory, then fifth cranial nerve, that is trigeminal, seventh cranial nerve, that is facial, ninth cranial nerve, that is glossopharyngeal, 10th cranial nerve, that is vagus, 11th cranial nerve, that is accessory, and 12th cranial nerve, that is hypoglossal. My dear friends, cranial nerves are 12 in number. They are first olfactory, second optic, third oculomotor, fourth trochlear, fifth trigeminal, sixth abducent, seventh facial, eighth vestibulocochlear, ninth glossopharyngeal, 10th vagus, 11th accessory, and 12th hypoglossal. The cranial nerves should be examined systematically in a sequential order. For example, second, third, fourth, sixth, eighth cranial nerves are already dealt elsewhere. So naturally, that means in another videos, we will discuss these nerves, the sensory, spatial sensory, and motor functions of other cranial nerves will be discussed over here. Now let us see what can be the material to do this clinical examination. The students or the doctor will need the cotton, pins, test tubes containing one test tube with warm water, one test tube with cold water, then hammer and tongue depressor, then material for the examination of taste sensation and also the smell sensation. Now, we will start with the first olfactory nerve. Smell is one of the spatial senses. Clinical examination of smell is useful for the study of first cranial nerve. Substances used for clinical examination of smell: peppermint, eucalyptus, camphor, asafoetida, oil of clove, etc. can be used, but irritants should not be used. Now, how we can process? Ask the patient to clean the nose. Instruct the patient to close one of his nostril, open one of the bottle and hand it to him. Instruct to close both the eyes. This is very important. Ask the patient to smell the substance in the bottle. Ask the patient to identify what is that particular smell is about. Repeat for each nostril. Then repeat with the different bottles, like for example, eucalyptus, peppermint, etc. Repeat the whole procedure with the other nostril. This is what we have seen about the olfactory nerve. Now I am proceeding further. Fifth, or the trigeminal nerve. This trigeminal nerve has a sensory function as well as motor function. What is the sensory function of trigeminal nerve, cranial nerve? Note the trophic lesions, if any, over the face. Examine the touch, pain, and temperature sensations over the face. The sensations may be tested as in the examination of sensory system, remembering well the areas of distribution of three divisions of trigeminal nerve. Now, we will see the motor functions of trigeminal nerve. Note the vesting of muscles of mastications, if any. Test the power of temporalis and masseter by asking the patient to clench the teeth. Feel the tightness or the tautness of the muscles. Test the power of pterygoids by side-to-side movement of the partially open jaw. Test for the deafness on the affected side to look the integrity of the tensor tympani. Now, the doctor should elicit the following reflexes: conjunctival reflex, corneal reflex, and the jaw jerk. Now, we are going further to see the seventh, or the facial nerve. It is a spatial, sensory, and motor functions. First, we will see about the motor functions of facial nerve. Test the power of the following muscles of facial expression. For example, frontalis muscle. Ask the subject to wrinkle the forehead by looking upwards. Now, the doctor wants to check orbicularis oculi muscle. Try to open the tightly shut eyes by the patient. Buccinator. Doctor will ask the patient to puff out the cheeks. Then doctor will apply firm pressure over the cheeks. Next muscle is a platysma. Ask the patient to evert lower lip and draw the angle of the mouth downwards with maximum effort. We are testing the facial nerve. Now there is orbicularis oris. Ask the patient to whistle or say labials like P, B, M. Now doctor should note whether there is any abnormal acuity of hearing on the affected side to see whether the branch of the stapedius is affected or not. In upper motor neuron paralysis, only lower portion of the face on the opposite side is affected, while in the lower motor neuron paralysis, the whole half of the face is affected on the same side. Now we are moving further, the ninth, or the glossopharyngeal nerve, 10th, or the vagus nerve, 11th, or accessory nerve. Ninth nerve has a sensory, spatial sensory, motor, and parasympathetic fibers. 10th vagus nerve has a sensory and motor functions and has parasympathetic secretomotor fibers. Cranial portion of the 11th nerve is responsible for normal phonation and swallowing. Now, sensory motor functions of 9th, 10th, and cranial portion of 11th nerve. Ask for the history of nasal regurgitation, which is seen in the soft palate paralysis, and also ask about the history of nasal speech, which can be seen in palatopharyngeal muscle palsy. Ask the patient to say ah. Normally, the uvula is central and moves backwards in the median plane when the subject says ah. In vagal paralysis, it is deviated to the normal side. Ask the subject to swallow to test the laryngeal muscles. Pharyngeal reflex can also be elicited by doctor. Laryngoscopic examination can be done to visualize the vocal cords. There will be abductor muscle paralysis if the recurrent laryngeal branch of the vagus is damaged. Now, spinal portion of 11th nerve. It has motor functions. Trapezius is the name of the muscle. Ask the subject to shrug the shoulders with and without resistance. Sternomastoid muscle. To check, ask the subject to turn his head to opposite side with or without resistance. Now, spatial sensory function of facial and glossopharyngeal nerve. Taste is one of the spatial senses. The clinical examination of taste helps to test a spatial sensory part of seventh, that is facial, and ninth, that is glossopharyngeal cranial nerves. We know that anterior two-thirds of the tongue is supplied by chorda tympani branch of the facial nerve. Posterior one-third of the tongue is supplied by glossopharyngeal nerve. Now we want to see the sensory function. So what is the procedure? Ask the subject to sit comfortably on the stool. Ask the patient to gargle and clean the mouth. Ask the patient to protrude the tongue. Dip the application in one solution, take it out, and drain the excess of solution. Rub that particular solution gently on a part of tongue on one side. Ask the patient to pick up the slip on which the name of the test he pursues is written. Mop the solution and saliva with wet and then dry gauze. Repeat on different parts of the tongue on each side, right and left. Repeat the same procedure with different solutions. Examine both the halves of the tongue separately. Now we are talking about 12th or the hypoglossal nerve. It has only motor functions. Ask the subject or patient to protrude the tongue. Normally it is in the center, but tongue may deviate to the affected side. Then doctor should test the tongue movements in all directions. So my dear friend, this was a totally understanding part. Now how to fill up your case paper. First you have to write down the name of the patient, age of the patient, and gender of the patient. Then you have to write down the olfactory nerve, smell pursuits, for example sanitizer smell you can give, left nostril normal smell, right nostril normal smell. Now we are talking about fifth cranial nerve, that is trigeminal. Trophic lesions whether present or absent, wasting of the muscles whether present or absent. Naturally in the healthy volunteers there will be all these conditions are absent. Now we will talk about sensory functions of trigeminal: touch, pain and temperature on face, normal right side, normal left side, all the three. Motor functions, that is we will see the movements of the muscles, temporalis movement, masseter movement and pterygoid movement, all are normal in the healthy individual, right and left side. Now we can see the reflexes like conjunctival reflex, corneal reflex and jaw jerk, all will be normal in healthy individual. Now seventh cranial nerve, that is facial nerve. First, acuity of hearing, that is normal. Now to check the motor function, that is power of the muscle, you will have to check the frontalis muscle, orbicularis oculi muscle, buccinator, orbicularis oris and platysma muscle. Now about the 9th, 10th and portion of the 11th cranial nerve. Nasal regurgitation will be absent in healthy individual. Nasal twang will be absent in healthy individual. Motor functions will be normal. Position of the uvula in healthy individual normal. Movements of the palate normal. Pharyngeal reflex normal. Movement of the larynx normal. Now this is the spinal portion of 11th cranial nerve, that is accessory. We have to check the motor function, that is the power of the muscles like trapezius and sternomastoid, that should be normal in healthy volunteers. Spatial sensory portion of the 7th or facial and 9th or glossopharyngeal nerve. So we are going to test pursued sweet with the sugar, sour with the lemon and pungent with the chili for chili purpose. So on both sides of the tongue, right and left, they will be normal taste perception. Now 12th cranial nerve, that is hypoglossal, you have to check the position of the tongue, which should be central in the healthy individual, may be deviated in the patient. Tongue movements are possible in healthy individual, may not be possible in the patients. So my dear friends, this is all about the cranial nerve examination, what can be the questions asked in the examination? First question, what is bilateral innervation? When the same structure is supplied by the nerves from both the sides, or when the same structure is represented on both the sides of the cortex, it is called as bilateral innervation. Next question for the oral viva. How will you account for the manifestation of upper and lower motor neuron paralysis of the facial nerve? In upper motor neuron paralysis of the facial nerve, the lower part of the face on the opposite side is involved, while the upper part of the face escapes because of its bilateral cortical representation. Now, the lower part of the face derives its supranuclear fibers from the cortex of opposite side only. In the lower motor neuron paralysis of the facial nerve, the entire half of the face on the same side is affected because both the supranuclear fibers from the opposite and infranuclear fibers from the same sides are involved. Now, the last question, are cranial nerve nuclei upper motor neurons or lower motor neurons? Cranial nerve nuclei are lower motor neurons because their activity is controlled by higher centers. So, my dear friend, this is all about the cranial nerve examination. I wish you all the best, and I request all of you to like this video, share this video, and don't forget to subscribe my YouTube channel to understand the physiology in very easy manner. Thank you very much and take care. All the best.